The revamping of community health management committees is a primary health care project by Hope for Future Generations, with support from PAI that seeks to revamp 8 non-functioning community health management committees in the Ada West and Ningo-Prampram districts in Ghana. The Community Health Management Committee is constituted of leaders and members of a CHIPS zone to actively engage in the planning, designing, and implementation of healthcare services at the community level.
I've worked with and continue to work with Hope for Future Generations. When they came into our district and proposed this project, we welcomed them with open arms, knowing what they are capable of. With their help, we've been able to do some community mobilization with community health committee members in 4 of our 23 CHIP zones, and we are seeing that it is yielding fruit. Sense of ownership among community members has improved. The community health nurses who are very happy to work with their community health committee members, and they are seeing improvements in service delivery and in coverage.
The committees were supported to develop community health action plans specific to their zones and communities to guide their work.
So initially, the management team from SEGE comes and then we have our meeting. But now, because of the training, we are able to put down an action plan and then work on it on ourselves because of the training we have received.
With their action plans, the committees carried out activities under strict timelines to address some of the health challenges in their zones.
What I took out from the training is the action plan, that when you have a plan, you need to at least start mobilizing resources. And out of the plan, you have set your goals and you have set what you have to achieve. So you need to be working with other stakeholders, telling them your plan and what you wanted to achieve.
At Wokumagbe in the Ada West district, which was our first stop, the CHMCs organized a sensitization program on teenage pregnancy at the Wokumagbe Primary and Junior High School. Prior to that, the committee members had organized a cleanup exercise of the Wokumagbe community 2 days leading to this activity. The team joined in the conversation on teenage pregnancy, after which we made a tour of the community. Mainly a fishing community, Wokumagbe has no CHIPS compound but holds their health outreaches in this uncompleted church building. One of the major challenges of the community is poor sanitation caused by indiscriminate disposal of waste, which the CHMC is committed to addressing. The project team had a roundtable discussion with the committee to assess the performance of each committee member. Away from Wokumagbe, our next stop was Lekwono in the Ningo-Prampram district. This community has a CHIPS compound that serves the surrounding communities as well. With their action plan, the committee has been able to mobilize resources in the form of labor and capital to remedy some structural challenges at the CHIPS compound. With resources mobilized, they have successfully mounted 2 water tanks at the CHIPS compound and connected the water to the labor ward with provision of a sink to foster easy access to water and to promote hygiene.
For the first, we have to fetch water. The women have to fetch water to the delivery ward or to the other sectors where water will be needed. So, but now we have just connected the pipe down to the walls for it to be used quick at the ward. So this is what we have been done, and then we have done the tiles also, which has to be, because when the women deliver it, the blood spring on the wall, so we have to do that for them to be easily washed. So this is, we have a lot also continue to be doing.
The committee has also supported the CHIPS compound with the construction of a simple urinal. There was an assessment of the committee before proceeding to our next destination. At Machakope, the project team met with the Community Health Management Committee, who have already carried out most of their planned activities before our visit. As a farming community, the committee identified the biggest challenges facing the community as child labor, teenage pregnancy, and home birth. To address this, they carried out sensitization programs at the churches and some schools to first create awareness of the problems. They plan to organize more elaborate activities regularly to mitigate their challenges. Similar to Machakope, Sizakope is a farming community in the Ada West district. This committee had also organized a cleanup exercise and sensitization on poor sanitation in schools and churches before our visit. Their next plan is to acquire 3 dustbins for use at the CHIPS compound and 2 in the communities. With major support from the assemblyman at the Dowenya CHIPS zone, the committee raised funds and started the construction of a urinal for the CHIPS compound.
If more people are trained, apart from the Community Health Management Committee members, information on primary health care will go to a larger group of the community to understand the CHIPS concept.
The mobilization of how to get funds to finance what you have taught us, maybe it also has went well. We contact the various areas, the fishermen, the premise fuel, the drivers union, then we the inhabitants of the community. So I learned when we just send a message across, everybody puts hands on deck, and then we have done a little. We get some small money, and we have done a little.
They didn't know they could even do better without the support of a government. So as you have played a role in their settings, as in their meetings, telling them about how they can use their own resources to manage a facility without involving the government has been so helpful.
One, I would say that it has really helped my volunteers or my CAC members to be abreast with what they have to know concerning primary health care in Sizakope and then its catchment areas. And then to be able to tackle some problems that we were really facing in Sizakope and its catchment areas, and then how to even resolve it. The
training given to us let everybody know that the clinic belongs to we the community, not for the government. So if something has to be done, we have to put our efforts in it because we have to use it.